Mrs. Dr. Folake Olatunji David, Director of Basic Education, Federal Ministry of Education, Nigeria. Please, can we welcome them as they are coming? The third panelist that we will be having for this session is Mrs. Olapeju Ibekwe, Chief Executive Officer of Sterling One Foundation. Please, can we welcome her also? The fourth person that we'll be having is Dr. Amidou Bukari, Senior Program Specialist, Knowledge and Innovation Exchange, IDRC. Can we welcome him, please? And finally, the last person who will be joining us online is Mrs. Kayla Roberts. She is representing the University of Auckland, and she will be joining us virtually. So those that will be facilitating this session, we have as moderator, Mr. Idrissa Dia, the Acting Director, Economic Social Infrastructure. Can we welcome him, please? And finally, the rapporteur for this session will be Mr. Olawale Samuel from the Africa Regional Help Coordinator, Leading Through Learning USAID. Can we welcome him, please? Okay, so I believe the panel is set. We are all ready to listen to you and the discussion that will flow through. Thank you. And we also remind that there are participants who are following online and who will be joining and asking questions from the discussion that are ongoing here. Thank you.
Thank you very much for that introduction, and welcome to the Honorable Minister, the representative of international organizations, governments, representatives of the private and civil society, and distinguished guests that are physically present here and who are also participating online. I know it's a bit late and people are tired after a very long day, so we can understand that. So we'll try also to shorten a bit the length of this session against what was initially expected. But we still hope to have engaging discussions and sharing of knowledge here. So thank you very much to all of you. So I'm working in IDB in a capacity of Director of Economic and Social Infrastructure that covers also health, education, nutrition, and ICT, among others. So a good match for the discussion of today. Ladies, honorable guests and gentlemen, keeping in mind that the central theme of this triennial, that is focused on reflecting on the impact of COVID on Africa's educational system and how it has affected the elements of access, quality, relevance, but also how to build more resilient and a sustainable education system and skills. This session will focus on the specific impact of COVID, as we said, on those three key parameters that are access, quality, and equity in the system. So it will be my also pleasure to start now by introducing our panelists or reintroducing them in a short way in terms of the order of interventions. We will start by the Honorable Minister from Uganda, and then we will have in the panel of discussion Mrs. Folake Olatunji David, followed by Olapeju Ibekwe and Dr. Hamidou Bukari, And last but not least, our colleague Kyla Boisvert from the University of Auckland. But to get started right now, allow me to welcome on board Dr. Moses Ngware of the African Population and Health Research Center to give us the expert perspective that will help us to warm up the discussion. It was allocated 10 minutes initially, but I will appeal to him maybe to compress. I know it's a difficult task. Maybe his expert perspective views sharing in about 5 to 6 minutes so that we catch up a bit on the time. Dr. Moses, the floor is yours. I don't know. Yes, you can use this if it is easier for you.
That's fine. Thank you very much.
Thank you.
Thank you very much, moderator. Good afternoon, everyone. Yes, my name is Moses Ngware from the African Population and Health Research Center. I'm going to be very brief in the interest of time and as requested by the moderator. And really my remarks will focus on the question on how research can help assess government efforts to improve policy and practice to sustain learning during crisis. And I will share with you my thoughts on that and how that could be done. And really what we're talking about here is knowledge mobilization and knowledge generation, and getting to the decision makers. Also, what I see in this question is how do you influence the decision makers? For example, working from the inside. But then, even from that perspective, we do know that we do not make policies every day. We don't. We make decisions every day. Sometimes you can go for a whole year, you've not made a policy, but you've made many decisions. So, from my perspective, I like looking at it as influencing decisions. But why? Because right decisions strengthen policy implementation. And if you strengthen policy implementation, you are moving closer to the outcomes that you are looking for. So, for the research generation ecosystem, the ultimate target is to influence policy and practice, but start by influencing the decisions. Now, we have a couple of strategies that we've applied out there, and they've been used even by others, in terms of how do you do that? How do you influence decisions? And this is why I like talking about decision makers. Even as we talk about policymakers, I like talking a lot about decision makers. So, one of the strategies is who influences them. In our case, we've been working with ADEA, for example. It can make a convenience, they can convene decision makers, like what we've done in the trial now. It's a very, very good strategy. Of course, we have others that can also do that, like the AU, the regional blocks, the laterals, the partners. So the question is, who influences the decision maker? Now, the other strategy that we've also used is the direct engagement that sought evidence from the researchers, for example. Yes, there is demand, and the decision makers can come directly to researchers to ask for data. And we've had examples here from the previous ministers who spoke, even in the last session. The other one is co-design and engagement throughout the implementation period. That the co-design is very critical because of the buy-in, because of understanding the context, because of ensuring that researchers are speaking to the real issues that are of interest to the decision makers. And then we have the participatory, of course, and interdisciplinary research approaches so that it can help us to reach even those who are outside the education sector. Earlier on, there was a lot of talk about industry. But many times, you realize that sometimes we leave them out. When we are discussing about policy issues, when we have this kind of gathering like the one we have today, probably more than 90% of all of us are within the education sector. But then we want to engage with the industry. So we needed to remember that they are also part of our decision makers that we needed to talk to. Now I'll move and skip several things and then zero on a few other things that we did, we've been doing. With ADEA, for example, so that we can also reach to the policy and the decision makers. And I'll only zero on only one that probably many times we shy away from it, and this will be the last one, Mr. Moderator. We shy away from talking about finances many times, and we say that's about the politicians. I know the ministers are with us here, so the ministers will not avoid that one, okay? The finances. And I want to share with you very quickly what is it that we found in terms when we were working with ADEA, the consortium led by ADEA to look at the COVID-19 responses in education, both policies and practices. How did they, especially GP partner countries, how did they respond in terms of, and it's good that the previous session talked about the planning and all that. But then money was required. Money was required and it was needed. Now, one of the things that we found was in these responses, finances were going to distance learning during school closures, and we got very good examples. The radio, the TVs, those programs, they required to be supported. And we got very good examples. Of course, we had from the Gambia, we had from the Uganda, but we also had like examples from Burkina Faso called Cape Verde. All that we find very good resources and concerted efforts in terms of resources going to that area. We also find teacher training. That's the other area where money was needed and money went there. Teacher training. And we have good examples from Ghana, from South Sudan, from Zambia, from Kenya. And again, we have provision of water, sanitation, and hygiene, the WASH. Again, a lot of money also went there. And finally, we have the support to vulnerable populations. We find those 4 areas is where most countries concentrated in. But despite that, the resources required were huge. And in total for the 40 GP countries, they needed almost 1.4 billion USD. But the resources available were about 400 million USD. You can see the gap. So in total, the countries could be able to mobilize about 30% of the resources. So what does that tell us? Now, majority of those resources went to the school reopening related activities. This is where you do the classrooms, makeshift things, infrastructure, and they're expensive, about 30%. But on the other hand, we have resources going to the most vulnerable. The 10%, 20% harder to reach. It was almost 5%, very low. Now this has implications in terms of equity and inclusion, something to think about. And finally, is the issue of the challenges that we saw, and we found, and again, this one is good to share with the participants. For example, there was over-reliance on external support. This has implications to sustainability. And I know that was mentioned in the previous session, over-reliance on external support. It is not bad, it is a good thing, but then how do we create sustainability? How do we create the ownership? Ownership is there, yes. How do we respond quickly before the resources come? I did not hear discussions about an involvement about the Ministry of Finance. I know they are very powerful in terms of the allocation. So, as a way forward, one of the recommendations or action points that we were recommending as I stop is the issue of also working with private sector to be able to also harness and immobilize internal resources. Because it's not easy, we have to harmonize, we have to mobilize them. Even as we look internally into our own ministries, into the allocation, into the political system to see how much can be pumped into responding to this kind of crisis within education, I think it would be good to consider bringing in those other players and especially the private sector. Very good, and especially when we are talking about distance learning, you know, they own some of the resources, the ICT infrastructure, and they come in very handy. They did come in, but we do think that I think more can be done in terms of the collaboration. So let me stop there, moderator. Thank you very much.
Thank you, Dr. Moses. Thank you for the pertinent remarks and the confusion also. Sorry for having but we appreciate that point of view and the key points about influencing the decision makers in order to take the right policy decision. But based on research and evidence from the field. But also the importance of the question of the financing, be it the one coming from the government, which remains the biggest financier anyway, and people tend to forget it. The finances that come from the bilaterals and the multilaterals to come in support of actions of the government, but also the importance of the private sector to bring the sustainable funding models that allow the systems also, especially when we talk about investment on infrastructure, to be sustainable. So thank you for that expert perspective that will certainly enrich the discussions to come. And I would like to turn now to the Honorable Dr. Makabo Regina, from Minister of Basic Education from South Africa, to give us also the policy maker response again that interpellation that was made by Moses about the issue of the financing, but the issue of the right policy making environment that allow the system to take the right stand, but also the sustainable approaches. So, Honorable Dr. Makabo, you have the floor for the next 5 minutes, please. It seems she's not in the room, so apologies for that to the floor. And therefore we'll continue to, and I will now then go to the panelists. Now that we have some appropriate room temperature after this interpellation of the decision makers, to ask our panelists some question to kick off the conversation. We will then, after that stage, give the opportunity also to the floor to raise few questions. So, in the interest of time, I might start with Dr. Hamidou Boukari. Dr. Hamidou, can you tell us in 4 or 5 minutes, from your point of view, what do education systems in Africa need to do to be really more resilient, but in a sustainable manner, in times of crisis and beyond, and how we can build better education systems? I will not say to bring them back to the stage of pre-COVID, but to transform them for the better, taking into account the lessons from COVID? What can you tell us in 4 or 5 minutes? I know it's a challenge because there's so much to say.
Yeah,
but
exactly.
You can give us some hints in that regard, please.
Absolutely. Thank you very much, Mr. Moderator. Well, I have to say that this is a very complex question. So I would be pretentious to say that I have all the right answers. This is a $1 million question. And what I can share with you is just basically some of the reflections on what we have learned, because we have been working with ADEA on the observatory, the COVID observatory that has been put in place, and APHRC with Dr. Ngwari here have been doing the research. So we have learned quite a few things about how to make, well, at least these are lessons that could inform how to make systems, education systems, more resilient. And of course, also a few ideas in terms of how to actually build better, but I think I like what you said about more of a systems transformation. Yeah, so that's one. So to begin with, I think I would like to kind of challenge ourselves, to think a little bit about what do we mean by resilience, by system, resilience here. We talked a lot about it, we use it, and I have the impression that sometimes we're not very clear in terms of what we mean when we talk about systems that are resilient. So I'd like to, if you allow me a little bit, I'm trying to get my computer here back. I have put a few notes on this. I have a long password, and sometimes. Oh man, yeah, this is technology, and I think, yeah, I've removed the caps actually. So this is where a security, IT security, always tell you, have a very complex. Yeah, exactly. So anyway, it doesn't seem to cooperate. I don't know what is happening here. Yeah, okay, here we are. So as I said, it's just really trying to unpack the concept of resilience within the education sector in order to frame our discussion on how the COVID-19 pandemic and all the external and powerful forces or phenomena, such as armed conflict, I think it was mentioned here, natural disasters, flooding, have significantly and negatively impacted the teaching and learning processes, and this is the world over, and more particularly here in Africa. So, what is a resilient education system? I read, across and gleaned a few things here and there, and I started by the definition of resilience. It says here, and this is the Oxford Dictionary, says that it's the capacity to recover quickly from difficulties, toughness, or the ability of a substance or object to spring back into shape. There's something that has elasticity. So that's defined. Resilience implies that there are actually some inherent or inbuilt properties, characteristics that make an object or a system tough and resistant to big shocks. So when we apply this to institutions such as schools, it could be interpreted or assumed as the inbuilt capacity of systems to resume the teaching and learning processes in the four walls of classrooms that we know, within compounds that are administered by a whole cadre of professionals, teachers, administrators, etc., who create and maintain the necessary conditions for all learners across a country to acquire knowledge and competencies as prescribed by a nationwide curriculum through a set calendar. Furthermore, the school is embedded in a wider community or nation that entrusts it with its children and resources as parents and state actors that are convinced of its desirable outcomes. meaning here the quality of learning and also the future success in life that we promise to our students, to our learners. So the question is, when we present it this way, it's can we say that prior to COVID-19, African systems had always been functioning optimally and possessed inbuilt resistance to major disruptive shocks? So I don't know whether you heard, but there are some assumptions here, the major assumptions that we make. So sometimes we need to interrogate those assumptions to see whether they're well placed or maybe they're actually misplaced. So the first one that comes to mind is that we think that education system prior to COVID-19 were well equipped and functioning, and that's why we want to rebuild. And now we're actually agreeing that we need actually to transform, not to rebuild. And I have to say that the Minister of Uganda in her speech this morning really kind of, gave me say, what I'm going to talk about, I think she's talking about completely overhauling the system or jettisoning, the system and coming with the new one. So the second assumption is also that, is everybody really convinced of the desirable outcomes of schooling? And they should address this, Not everybody, can we say that we all agree and that the outcomes that we're seeing, the students that are coming out, are they very happy? Are they finding jobs? So she made that point very well, I think, very eloquently. So to answer the question of whether systems were somehow better off prior to COVID, I'd like to share a few observations. So this is what I have learned just preparing for this session on what people are saying and the whole discourse on this. So first and foremost, there are those who argue that it's really naive to believe that traditional methods of education will continue undisturbed. That actually that education has always been vulnerable. So that should have been a constant. So the issue they say is that some of us were just not paying attention to the plentiful of evidence that school closures have been with us for a while. And the most recent examples include the Ebola outbreak in 2014 in Liberia, Guinea, and Sierra Leone, and the destruction of schools during conflicts such as the ones experienced by the Sahelian countries currently, where in Burkina Faso alone, close to 300,000 children are out of schools, them and their teachers. Okay, 2 minutes, all right. So basically, what we're saying is that the education system, where we did not actually take, and I know I have ministers here, and it's very easy for us to blame people and say that they have not done what is, but I understood because you have also to understand the perspective from ministers, the kind of constraints they work under. So it's just to say that there were no contingency plans. That this is one of the major weaknesses that was found out. So they have forgotten that we know about these shocks are going to come, but somehow we just went on business as usual without really making any contingency plans. So the second aspect, and I'm not going maybe to go into much details, is that just to relate it to the work that we're doing with ADEA, and they have published 4 reports now that have been disseminated, I think, widely. In terms of what we have learned, because the idea was for them, for APHRC actually to look at what kind of responses countries are putting out there in terms of students, learners' well-being, the teachers' well-being, and also the continuity of learning. So that was the idea, and try to synthesize, analyze, and then make recommendations to countries for them to implement. And I will just maybe briefly, Mr. Moderator, with your indulgence, just to mention maybe a few things that came out of this work. The first recommendation, there are key 5 ones. They say that African countries should generate domestic resources, and I think he alluded to that, for emergency responses in education to create sustainability. So this is again the contingency planning part. And a portion of such resources should be allocated to promoting equity and inclusion to help ensure vulnerable children, including girls and children with special needs, for them to access education. The issue, of course, of now the monitoring systems, data. We need to have data. I was very happy to hear the Minister of Education of the Gambia talking about how they want about getting data to exactly determine the kind of needs and whether they're prepared whether the communities are prepared actually to receive all this distance education that was being provided. I would like maybe to stop here because I don't want, because all these issues you have heard them, because some of these you know them. So I'll just stop here for us, and then we will be able to discuss some of these issues, and particularly this issue of why is it that contingency planning is not, done, or if it's done, what are the major constraints?
Thank you very much, Dr. Amadou. Thank you very much, and I know it's unfair to you and to most of the interveners that we should have had more time to elaborate on some of these key points. But I think we should take the preliminary challenge you put on the table regarding building a common understanding of what the resilience that we are talking about is all about. I think that's the key thing, to make sure that also we are raising the right question to be able to grasp the right answers. And saying that the premises against which those challenges or questions are raised are important also. What do we want to achieve? And you're right in quoting the Honorable Minister from Uganda this morning, that pushes us quite far in terms of rethinking completely the basic assumptions on which the system is built or should recover against. That's a key point. The point you raised also in terms of putting the right emphasis on the outcome. What do we want to measure when we talk about this resilience and issues related to sustainability is key to inform decision making. And last but not least, definitely we all agreed, I think, during all these sessions on the issue of readiness, preparedness, because unfortunately that might not be the last pandemic, and if it is the last pandemic as we would wish, at least at this scale, the shocks would still be there. Flooding related to climate change, extreme weather conditions and so forth, we will have to deal with, because they can also lead to school closures and so forth. So importance of preparedness, contingency plan. Thank you for that contribution. Now, allow me to go virtual for a moment, given also the time lag from here, and give an opportunity to Dr. Kayla Boisvert from the University of Auckland to elaborate on how research that both Dr. Moses and Dr. Bukari were talking about, how research can help us assess better the government efforts in order to change policy and practice geared at sustaining learning in the context of crisis. Mrs. Kayla, you have the floor. Mrs. Kayla, are you with us?
Yes, can you hear me?
I hope she did not get discouraged because of the law. Yeah, she's alive. It's the volume? Yeah, we can't hear you. Don't know if it is on your side or on this side. Technicians are checking the matter.
Can you hear me now?
Can you check your speakers in the meantime?
Yes, I will check. Thank you.
Yes.
Can you hear me now?
Yes, perfectly. So please go ahead.
Great.
Welcome.
Thank you very much. Yes, thank you very much for the invitation and the opportunity to share on this panel with all of the distinguished guests and to participate virtually. So I'm here presenting on behalf of a research team at the University of Auckland, and we're doing a research study with USAID and through the Leading Through Learning global platform. And what I would like to share today in relation to your question about helping governments assess efforts to change policy and practice geared towards sustaining learning we are looking at how actually a wide range of interventions around the world, but with a clear focus in Africa, are actually working to, within their own interventions and with their work with partners, including ministries of education, how they're actually working to move from what we call absorptive capacities, absorptive resilience capacities, towards more transformative capacities. And so we're trying to use this research particularly to understand a little bit more about how both government efforts and how implementer efforts can support moving from more reactive ways of responding to the pandemic and future crises towards those that are actually more transformative for sustainable outcomes moving forward. So one of the things that I wanted to speak to really is related to what Dr. Bukhari had shared about, which is the question about what do we mean about resilience. And I think that this is really, really related to the question about thinking about how governments can change policy and practice towards sustaining learning during, after crises. And that's because we look at resilience as a process, not an outcome. So it's a process that's always undergoing, and it's for the purpose of exactly what you've asked, around leading to learning outcomes being sustained and improved during crises, but also how do we change the policy environment, the implementation environment around learners, especially those who are most vulnerable, to be able to have these opportunities moving forward. When we talk a little bit about moving from absorptive capacities towards transformative capacities, we're talking about in the COVID-19 pandemic, we could do many different things to respond to the crisis. We could address the immediate shock and stressor and minimize sort of the risk that learners are facing, and we could figure out how to cope with the pandemic. That might be things like rolling out new distance learning strategies in the moment, doing the best that we can, but kind of reacting to the problem at present. Or we could be a little bit more anticipatory and mitigate shocks and stressors in the future. And that might be things like building existing partnerships, setting up systems for rolling out distance learning options in the future, in future school closures. Or even better yet, we can think about more being transformative or addressing underlying vulnerabilities. So why is it that some children can't access distance learning? Why is it that some children can't return to school after school closures? And what are the underlying social and political factors that are influencing these outcomes? So in our research, we're really looking for ways that interventions and governments are using COVID-19 as really an opportunity to build more adaptive and transformative resilience capacities. And some of the ways that we're seeing them do that are through a couple of different things. So what we're seeing we've selected 9 interventions that are going to be included in our study. And in order to sort of decide on these interventions, we've gone through a rigorous process of putting out a call for proposals, analyzing the evidence that learners have, that interventions have in support of their learner outcomes, and then really assessing what are some of these factors that are enabling them to be able to mitigate learning loss, sustain learning outcomes, and even improve learning outcomes. So some of the things that we're really starting to see are focused on looking at how interventions are using evidence for iteration and adaptation. And I was trying to put my video on to join you all, but I don't have permissions to do that. Sorry about that. One of the ways that we're seeing that is really through using iteration and adaptation in order to kind of figure out what are the needs of learners and how they're able to adapt their programming in order to support learners to return to learning, to continue to develop important literacy and numeracy skills. Another way that we are really looking at is how programs are leveraging partnerships to build on partnerships that they already have in order to sustain learning outcomes, to build new collaborations in order to support, excuse me, sorry, I'm also trying to share my screen and that's not working, so I apologize for that.
Not a problem, Kayla, and apologies because we might have to go in about 2 minutes to the next speaker. So
Yep.
sorry to press you a bit, but yes, you can go ahead for about 2 more minutes, please.
Yes, absolutely. So one of the things that we're also looking at is really looking at how some interventions are leveraging their partnerships with students, families, and communities, as well as with local partners and governments. And really the third thing that we're seeing that is hopefully going to be strengthening resilience capacities, and especially transformative capacities moving forward, is looking at how many of the interventions we're working with are focusing on scaling towards sustainable action. So many of the interventions we've looked at have actually piloted some of their interventions, including distance learning, teacher training, with an aim to be scalable, both at the national scale, as well as across various countries. So thank you very much for the opportunity to share a few thoughts on some of this research, and hopefully the presentation will be able to be shared at a later point.
Thank you, Dr. Kayla. And again, apologies for keeping you longer with the time lag, the time distance, and at the same time for pushing you a bit to shorten the presentation. Again, I think it's not totally fair to you intervene, but that's the necessity of today. Thank you for that perspective, and we noted very duly the necessity to go from a reactive approach to a more forward-looking one, focused on outcome and really transformative approach to capacity in the education system, and also accepting the idea that resilience is a journey. It's not a destination. It's a process and not an outcome. But something also that kept coming is about focusing on the most vulnerable, because we kept seeing the inequalities built in the system, or that are given sometimes in a very, very visible manner. So in helping this transformation, we need also to focus on the most vulnerable, those who need us the most. And finally, that COVID has been an opportunity to open the eyes wider and take the right policy decisions that would transform the system, knowing that there is so much space to fill that partnership remains a key and a cornerstone to succeed in that area. So thank you for that perspective. And I think we can now hear from a practitioner also, Dr. Folake Olatunji David, who will tell us how she sees that indigenous knowledge and African-driven innovations and solutions can help in building more robust and again resilient, but now I become careful about resilience since Dr. Bukhari challenges on that. So how those innovative and native or African-driven innovation can help build more resilient education systems in the continent. Thank you. So we will also ask you to try to manage the 5 minutes.
Thank you very much, moderator, distinguished members of the panel, and their participants. Yes, we've been looking at the issue of building resilience going forward as African nations, especially for our education system. Yes, COVID hit the whole world, but hit us as Africans. And we have our culture, we have our way of doing things that make us distinct from every other person on the earth. And if you look at what we have going for us as Africans, yes, we have to look at best practices globally, We've learned a lot from the discussions we have had since morning, how we're going to take it forward so that we'll not come back to the same issues at the next conference. So as Africans, we have to do things taking advantage of what we have going for us to build on our systems. We know that we have the systems of our traditional systems, we have our governance systems. Within our nations, within our states, we still have our African communities. So how do we take advantage of this? First, we can look at getting our children fully back to school, what we did in Nigeria and what we can also, I also know that we can also do in other countries, is taking advantage of these community settings. Leaders in the communities, traditional leaders, religious leaders, people pay attention to whatever they say, and ensuring we use local innovation to get our children into school, to get them enrolled, and through having partnerships with these traditional and religious leaders to drive enrollment, retention, and completion in our schools. We can also use community learning hubs, and these are things we have done in Nigeria after COVID. The community learning hubs, we engage non-state actors, NGOs, community-based organizations, and we have learning hubs within our communities. We have where people gather, maybe a town center, community center, where people gather informally, maybe in the evenings. We use this as community learning hubs to continue learning, even when schools close down. We can still continue using these hubs and engaging these civil society organizations, community-based organizations, to ensure that our children are learning, even when we have issues that tamper with our schooling in our community, so that even when there's school closures, learning still continues. We also use radio in local languages. We have, even where people don't have access to electricity and the rest of them, they still find a way around you have them with their transistor radios and the rest of them. So we can take advantage of this and make lessons in languages of the community, of the environment, where they can pass messages across. We've learned a lot of experience from other countries, and also in Nigeria, messages can be translated, and we have this during COVID. We can continue doing this to ensure that we pass on the messages, the lessons to our learners wherever they are. We also have the issue of unemployed youth. We are all grappling with this issue. We have them in their numbers. So we can make lemon or lemonade out of lemon, and ensuring that we look at these unemployed young graduates and use them to support the teaching and learning, the educational system. We can use them as teaching assistants in classrooms to deal with large classes, where we have large class sizes and we have issues of not having enough teachers. They can be engaged to manage classroom experience and given some form of incentive to help them to cope with life while they still find what to do next. We can also use, have local survey, do local survey with communities to find out what drives the informal economy. Most of our societies, our African settings, they dwell on informal economy. So what drives these informal economies? Let's look at what we can do to engage, train the youth in different skills that are very prevalent in the informal economies. Train them in things like soap making, tiling, sewing, shoemaking, and the rest of them. They earn a living and they are also engaged positively, rather than bewailing and looking at what we can do with our teeming unemployed youth. This way they will be useful. This way they can also support the educational system, and they also make something, earn a living while they are, even become employers of labor, such that the education they have is not a waste. Rather, we build on what is available by using local surveys. We don't have to do all the huge analysis and the rest of them. We can take advantage of communities, community system, and do a reporting and see, okay, within each community, how many youths do we have that are not gainfully employed? We can also look at, in our schools in Nigeria, we have what we call the school-based management committees. It is mandatory, there's a national policy that all schools must have a management committee comprising of the community people, not just the parents, but the school, because the school belongs to the communities anyway. So we engage the actors, the people in the community that have a say to manage the affairs of the community. These can be trained, they are being trained and being given some amount to manage the schools within their community and to provide we provide grants to them. We can continue to give them some money. They have a plan, school improvement plan, to look at the schools where they need to build more wash facilities, where they need to look at the infrastructure to cope with what is happening and to cope with even having children return to school. So these school-based management committees locally within our systems can be trained, and they can use them. We will use them to supplement and expand what the states and the donors are doing within our communities. We can also use a combination of radio, television, take-home materials, and materials published in local newspapers. In our communities, we have newspapers that are published within the community. We have a way of sharing information within our communities. Therefore, we can have these materials in the local languages and within even the community hubs that we have, and provide some form of digitalization even to these communities, even offline, to ensure that there's continuity of learning, as well as, like I said earlier, to have these materials in local languages. And of course, the policy on education supports that the education of children at the lower early grade should be in the language of the immediate environment. So when we have these materials provided in the language of immediate environment, we have them being able to learn better, especially for foundational literacy and numeracy. And then we also should anticipate the rise in dropout of girls. We know that schools closed, a lot of girls will not, they are not returning to school. But we should have a re-entry program like we are having in Nigeria, where we have girls that were pregnant being able to come back to school and ensure that we introduce, even the girls that are married, where we have cases of early marriages, they can return to school and continue learning. It's not as if we are encouraging them to get pregnant or be married off early, but not to lose the resources embedded in these girls. So we are having a policy on returning girls to school. Yes, okay, I'm running off now. So girls being returned, re-entry of girls, and even teaching them to even learn how to prevent pregnancy, but also, of course, when it happens, how they can be we have a re-entry package for them. So these are some of the ways we can take advantage of our Africanness and build more resilient systems. Thank you very much.
Thank you very much, Dr. Folake, and again, apologies. That's the inconvenience when we are at the latest station. We have to absorb now the time that was, meaning that is left for us. We really, I think, heard you, and that we have to do the things differently, not discarding what exists, but complement it with our African traditional heritage, if I may say so, related to learning. What you call the Africanness, I like the terminology, that needs to be injected also in the education system and give a key place to communities, to continue to own or re-own the education and teaching, especially for the youngest among the learners. The issue of the utilization of local languages that have been already terrorized maybe 50 years ago by some African prominent researchers, but with relatively limited impact on the education system. And last but not least, train also the learners, taking into account our local economic realities with the issue of the informality, which we should value also to a certain way. In many African countries, the informal economy is up to sometimes 60–65% or more of the real economy. And yet, these are not valued type of jobs that they provide, without which our societies would have collapsed. They are the absorbers of shocks in terms of crisis. So I think these are points that are well taken. We thank you for that. And now we should turn to somebody who is in the real economy also, and who can tell us what lessons from the implementation of remote education programs and policies can be learned to improve education quality and develop a more robust system. I'm still afraid of using resilient now. So I turn to our colleague Olapeju Ibekwe. Please, again, an apology for the next 5 minutes, as much as you can.
Thank you very much, dear moderator, distinguished panelists, and dear delegates. I'll work with 5 minutes, like you have requested. And quickly, the major highlights of what we would say we have learned from COVID in our experience, and for the benefit of those in the room, I lead the Sterling One Foundation. Sterling One Foundation is a private foundation in Nigeria affiliated to a financial institution, Sterling Bank. In our experience, we have realized 4 major things. Number one, there is a critical need for us to invest massively in digitization across all levels of education. One. The second thing we need to critically invest in is teacher capacities and capabilities to be able to not just share knowledge, but also know how to give the same quality of education they would rather give offline, online. 2, and then the third thing that we also need to prioritize is strengthening of the ecosystem, the structures, the infrastructure that needs to be strengthened. Then the fourth thing that is extremely important is funding partnerships. You did mention funding, and we will stay funding boldly with our chests. Yes, funding is extremely critical, and at the Sterling One Foundation, we have prioritized collaboration and partnerships for us to be able to scale impact easily. From these 4 learnings, I will start with digitization. We started 2022 leveraging the opportunity COVID-19 presented to us, and we did capacity building for 60,000 youth across the 36 states of Nigeria. We taught them not just employability skills, we taught them vocational skills, we taught them entrepreneurship skills. Because yes, we know Nigerian population is over 200 million, and we have a huge challenge of employment. And that was an opportunity COVID-19 presented. Pre-COVID, no one would have thought you'd be able to do capacity building for 60,000 people at the same time, but that happened. Of course, it was a hybrid model, but it was only made possible because we invested in digitization. And we didn't do this alone. We did this with the Whitefield Foundation and the Coca-Cola Foundation, among other partners. Now that's one. Beyond this, with our partner Sterling Bank, we have come up with this solution called Unify. Unify completely replicates what is offline in the management, operations, and including classroom learning of higher education online. So per adventure, we ever have another case of COVID again, schools do not have to stop. And this, we're starting with the higher education. As we speak, it has already been launched. The University of Bayelsa has already been onboarded on it, and we have over 2,000 students already on it. While we're starting with higher education, the plan is to scale up to other levels of education over time, and of course across the continent over time. This is a solution, like she's mentioned, leveraging digitization. As we speak, we're looking to get more partners on board for us to scale this solution. That's for digitization. For funding, during COVID, our partner organization, Sterling Bank, actually provided over $1 million for schools at zero interest in facilities. Of course, we know at that time, these schools needed to invest in digitization, like we have mentioned, because so many of them didn't have the infrastructure to support that kind of learning. That was done during COVID. Post-COVID, we're actually setting up a fund, and this fund is to retool our human resource. Why? Based on data from the United Kingdom and the Canada permanent residency, we realized that between January and June 2022, about 92,000 Nigerian youth have emigrated. And we know that this is not just a Nigerian issue. Across Africa, there is widespread emigration. It's a $10 million fund, because if I'll use Nigeria as an example also, we currently have about 35,000 doctors, and we need 237,000 to be able to really meet the need. There's a gap, and that gap is increasing and widening every single day. This fund is to retool the human resource we have, because we have to churn out, using the healthcare workforce, about over 10,000 doctors every other year for us to be able to close this gap over the next couple of years. Now, that is speaking to funding also, and I'm use that as an example to stay within the 5 minutes. There's so many other things we're doing as the private sector with reference to funding education and ensuring that the opportunities COVID-19 has presented can be leveraged and we can build forward. And then, yes, let me use the word resilience. We can do resilience going into the future. I'm sure I made my 5 minutes.
Thank you very much. But that's why we want also private sector, because of effectiveness, including in timekeeping. So thank you for that. By no means, Madam Minister, it means that public sector is not effective, and it will be. It is, and I'm sure you will demonstrate that in a minute. So thank you, Mrs. Olapeju. We take good note of the importance of investing on the teachers' capabilities, investing in strengthening enabling infrastructure that allows also the deployment of systems that can support in more robust system. You say I did not say resilient because of Dr. Bukhari. To keep in view building products in terms of employable learners that would meet the demands of the market. Very important, because we train for what? That was a question that was raised this morning. And also build opportunities locally to prevent further brain drain of those brains that Africa needs the most. So thank you for contributing to that and understanding the importance of non-traditional actors of the education system, be it foundations, private sector that was already there, but that should probably take more space in support of public interventions in this system. So thank you for that point. And Honorable Minister Joyce Kaduchu, this time I made sure I pronounce it well. We apologize for the time, we made you wait, but this was for a purpose, to leave you with the best. So in terms of learning recovery, what type of policies, programs and partnerships do you think are needed to build a better system than prior to COVID? And how can we build better with women and youth-led innovations? And that connects very well with the intervention of Mrs. Olapejo. So you have the floor, and so to be fair with the others, we will give you maybe 2 more minutes. So we give you 7 minutes because you have been waiting so much. Thank you.
Thank you so much. You know, it's not easy to speak when you are the last, when everybody is really tired and exhausted. Nevertheless, I'm sitting here on behalf of my senior minister, Mama Janet Museveni, who is the Minister of Education and Sports, and I'm so happy that she too is a champion in the spotlight, as you saw the message that was presented this morning on the fundamental foundational learning. I came with a team, and they are here, others are not here. You could raise up your hands to see those who came from Pearl of Africa, if at all they are here. Thank you. So Uganda is well represented, and we are happy that we are here. Coming back to the point that I should discuss on issues of strategy, policy, how we can link this to produce a better outcome after COVID. I just want to say that as we think of putting policy strategies in place, we need to think about homemade solutions, homemade strategy, and local policies that are favorable to our countries. And in line with that, I really want to think it is time for us to really act as member states. We need to move away from lamentation, from complaining, from being disgusted, and we commit, then we move into action, implementing whatever we have discussed. Now, I'm going to put my discussion on 5 pillars in the interest of time. I'll talk about 1 on the curriculum, 2, the teaching profession. The 3rd one, I'll talk about community-led learning that is being translated into policy. 4th, I'll talk about the low-cost infrastructure. And the 5th, digitalization, because I'm bringing the policy perspective, how our policy, which is evidence-based, relevant, can help to put a better education system after COVID. Now, in terms of curriculum, I want to appreciate many member states. We've moved away from knowledge-based curriculum to evidence-based curriculum. And this has been because of the studies that have been done. Evidence has been done in many countries, a multi-cluster study that is incredible studies have been done, and the results have demonstrated clearly what my colleague presented this morning, that our curriculum is not meeting the demands in the current market strategy. The job market is far away different from the curriculum we're implementing, and that is where the policy has enabled us translating the evidence-based incredible research into policy that is being implemented. And we believe with the COVID, with the post-COVID, this curriculum process that many countries are implementing, others are yet to start, will enable us to produce citizens who are job creators. Already when we look at our curriculum, a case in point in Uganda, you take a senior 2 student, which curriculum is student-based, being innovative, critical thinker, analytical skills, and they can translate the knowledge into practice. They are able quickly to convert, example, sun into heat. How best can I convert the heat, the sun heat that we have in abundance, to use to cook food? If a student at a secondary level is able to translate and come up with a practical something that can work, that means the future is bright. So that is one policy aspect that the study we are talking about can enable member states to implement within their context of each country. And of course, in line with that, we work with partners and we talk about the issue of data. For us in Uganda, we realize that we need to work with partners. In health, we have seen that surveillance, data collection, collecting data has enabled the health system to be strengthened, to be strong, and to implement many activities. So Ministry of Education in Uganda is working together with our partner. We are happy one is here. We are trying to bring on board the health information system tool, to redesign it to fit the education system, to put the parameters and the variables that is relevant to education, and how we can continuously collect data, which data can inform policy, and we can implement, we can monitor and survey such that we get better outcome. So that is on curriculum. The second issue is the teaching profession. The teaching profession that we talk about is also after a study was carried, multi-cluster study, that has found out that we need to standardize the profession, we need to regulate the profession, we need really to bring the profession on spotlight. And that is where, for us in Uganda, we are coming up with a national teacher policy to reduce the number of training institutions. I'm happy that many countries like Malawi has gone ahead, like Ghana, to ensure that every teacher, the minimum profession is bachelor. We remove our certificate, we remove our diploma, and we move to bachelor, but it is in a phased manner. It's in a stepwise manner. So this is in order to enable this teacher, to build this teacher in a holistic way, to deliver the quality education we all desire for a better outcome. But as we talk of this, we also look at the welfare of the teacher. As a country, we've moved ahead to increase the salary of the teachers, but in a phased way. So the teaching profession is one area that we look at how best it can, the policy can enable us to come up with a better teaching and eventually better outcome. The third area is quite interesting, community-led learning. COVID has taught us we move away from the usual way of doing things. We think out of box. When the schools were closed, we tried to bring on board all sorts of measures, the radios, the television, the home learning materials, but importantly, the community-led learning, where we have learning facilities embedded in the community, quite a number of them. And this is where the local leaders take charge of the learning facilities, and it is focusing the lower primary schools, and specifically numeracy and literacy, such that we continue with the learning process, we improve inequality, and this is one area that we thought it has enabled us. The community got interested, they got involved in the learning of their children. So we want to integrate this practice. We want to ensure this community aspect is integrated into our learning process such that all stakeholders become responsible in the learning process of our children. And this is where this process, we studied the data, we collected information, and it has been proven to really help people. So this is being translated to a policy, to a strategy that will help our people to get involved in the learning of their children. The fourth one is the low-cost infrastructure. COVID has taught us a lot. During COVID, we're having meetings outside, outdoors. During COVID, people prefer to be out, even the learning. So this has come up with what policy can we put in place to develop a low-cost, simple, homemade infrastructure. Infrastructure that we can, within our means, that we are able to manage with the resources we have, such that we are able to accommodate the number of children, because our fertility rate is very high as African countries. the growth rate is so fast. Some countries are growing at a terrific rate. In the next 2 years to come, there will be never enough classroom to accommodate our learners. So we need to come up with the policies that can enable us to build a low-cost, simple infrastructure within our means. That one can come out of policy, out of COVID experience. The fifth one is, of course, we talked about it, the digitalizing our education system. We've seen learning is not all about sitting in a classroom and the teacher is just to teach out here. Learning is not about only just in a closed environment. That means policies that can come on board should think about blending education, could think about distant learning, could think about even learning when children are at home, like the community-based learning, like learning that using the laptop and what have you. So this is where the policy that we have can help the learning outcome become better. Last but not least, the component of partnership. We need the partners on board. We need to work with the partners. Like a case in point I told you in Uganda, we have quite a number of partners that we work together. And then, of course, domestic resource mobilization that can help finance the education system. Otherwise, after COVID, the resource envelope is not enough to really cater for all the needs that we have. So the issue of local domestic mobilization is key. As I conclude, I want to bring in one very important aspect of social determinants of education. Sometimes we think it's all about education. A child has failed to read and write because of the teacher's fault or because of failure of our education system. This is a child who is growing up in African context, in an environment typical in Africa, environment that has got various diseases. Anemia is there, malaria is there, malnutrition is there, and all environmental factors. So I want us to look beyond the classroom factor, because sometimes a child who is anemic, a child who is malnourished, it affects the cognitive development, it affects the motor system, it affects the performance of this child in school. So the education system, yes, we talk about without thinking beyond our own classroom. So the social determinants of education is very critical for us. That can also be captured into the policy matters. I've got a lot, but because of time factor, I think for now I can stop here. I thank you.
Thank you very much. And you had the reward of patience. So we had to allow you more time to finish. For the interest of the rapporteurs, and I apologize to the rapporteurs, I think we might not have to have time to have this restitution, but maybe we can sum it up, and certainly it will be made available, given that I received few signals that people are departing for the dinner already, and you should not miss that. But the importance of homemade solutions and strategies favorable to our member countries, and it echoes very well the passionate discussion or presentation we had this morning from your colleague minister about reimagining our education systems based on homegrown approach and change of the sense of purpose regarding our education systems. The need to reform curricula to produce citizens that are job creators, job makers, and not necessarily job seekers. I think it's important, and it goes very well along with what our colleague Olapeju said about people that are job ready, adapted to what the market requires at this moment. Improving the learning environment through putting teachers in better conditions, adapted to our means, of course, but giving them the motivation and the skills, the capacities that are needed to deliver good learning outcome with the learners. Community involvement, like Dr. Folake also raised earlier, extremely important. The digitalization that you all touched upon as an enabler to face current and future crises. And last but not least, the issue of the domestic resources to be the pillars for financing education in Africa, because that level of independence that you have been talking about, I would say mental independence to reform our education system should be based also on the resources that we put on the table. If you don't finance, then you will have to cope with the agenda of somebody else. I think this is also something that we Africans should be thinking about. If you want to be listened to on the way you have chosen, you have to put your resources there and leverage our private sector that is extremely flourishing entrepreneur in Africa to achieve that. Ladies, honorable guests, gentlemen, I think that this has been a very, very rich session. I apologize to the floor. We will not have, unfortunately, the time to take questions, but maybe we park it to the next triennial that you need to attend. And to our colleagues Samuel and Calvin, we apologize also to you. I'm sure I was seeing you taking a very conscious notes. I'm sure it will be available at the completion of this session. And we thank you in advance for that difficult job to summarize such rich proposals, suggestions, and practical solutions. So I want to thank everybody for attending, the panelists, the audience, physically and online, and ask you a last round of applause to both our panelists and to the patients of the Thank you very much. Thank you. Thank you. Thank you. Oh yeah, we need a photo. We need a beautiful photo.
Okay, so